Strategies to naturally reverse type 2 diabetes. Did you know it's possible to manage type 2 diabetes naturally and potentially reverse the condition without relying solely on medication? How can dietary changes, intermittent fasting, and physical exercise transform your health? What are the real benefits of a holistic approach to diabetes control? In this video, we will explore natural strategies for managing type 2 diabetes, understand how insulin resistance is the real problem, and discover how simple practices can make a significant difference in your life. Stay with us to learn more about these effective and sustainable approaches to control and possibly reverse type 2 diabetes. Let's get started. Natural treatment for type 2 diabetes. Treating type 2 diabetes naturally involves adopting strategies aimed at controlling and potentially reversing the condition without exclusive reliance on medication. One of the most effective approaches is dietary change. Diets rich in vegetables, fibers, and lean proteins, and low in refined carbohydrates, are recommended. Reducing the consumption of sugar and processed foods helps stabilize blood glucose levels and reduce insulin resistance. Another natural treatment method is intermittent fasting. This practice involves alternating periods of eating with periods of fasting, helping to lower insulin levels and allowing the body to use fat reserves for energy. Studies have shown that intermittent fasting can significantly improve insulin sensitivity and lower blood sugar levels. Regular physical exercise is also essential. Activities like walking, running, cycling, and weightlifting help increase insulin sensitivity and lower blood sugar levels. Stress management and adequate sleep also play an important role in the natural management of type 2 diabetes. Relaxation techniques such as meditation, yoga, and breathing exercises can help reduce cortisol levels, a hormone that can raise blood glucose levels. Therefore, the natural treatment of type 2 diabetes involves a holistic approach that includes dietary changes, physical activity, stress management, and fasting practices, providing an effective and sustainable alternative for disease control. Diabetes. How the disease evolves with medication use. The progression of type 2 diabetes is often associated with continuous medication use. Initially, many patients start with medications like metformin to control blood sugar levels. Metformin helps decrease glucose production by the liver and improves the body's sensitivity to insulin. However, over time, the effect of these medications may diminish, leading to the need for higher doses or the addition of new medications. Gliclazide and rosiglitazone are other common medications used in diabetes treatment. Gliclazide stimulates the pancreas to release more insulin, while rosiglitazone improves insulin sensitivity in muscle and fat cells. However, these medications can also lose effectiveness over time, resulting in a cycle of adding medications to try to keep blood sugar levels under control. In many cases, the progression of diabetes leads to the need for exogenous insulin. Patients may start with small doses of basal insulin and eventually require higher doses or fast-acting insulin to control glucose spikes after meals. This progressive increase in insulin use can be frustrating for patients, as despite increased glucose level control, the underlying disease continues to worsen due to insulin resistance. The growing reliance on medications to control type 2 diabetes can be problematic. Besides potential side effects, there is the issue that these medications primarily treat the symptoms, high blood sugar levels, and not the underlying cause of insulin resistance. Therefore, it is essential to consider alternative approaches, such as lifestyle changes and dietary interventions, to combat the progression of diabetes more effectively and sustainably. Diabetes medications. Comparison and efficacy. Diabetes medications for type 2 diabetes vary in their mechanisms of action and efficacy. Metformin, gliclazide, and rosiglitazone are three commonly used examples, each with its own characteristics. Metformin is generally the first-line treatment. It works by reducing glucose production by the liver and increasing the body's sensitivity to insulin. It is well tolerated and has a favorable safety profile, with additional benefits such as potential weight loss. However, it can cause gastrointestinal side effects in some people. Gliclazide is a sulfonylurea that stimulates the pancreas to produce more insulin. It is effective in reducing blood glucose levels but can lead to weight gain and the risk of hypoglycemia, especially if not administered correctly. Gliclazide is useful for patients who still have some capacity for insulin production by the pancreas. Rosiglitazone belongs to the thiazolidinedione class and works by increasing insulin sensitivity in muscle and fat cells. Although effective, its use has been controversial due to concerns about side effects such as weight gain, fluid retention, and potential cardiovascular risks. Due to these concerns, its use has decreased in recent years. In comparison, each medication has its advantages and disadvantages. Metformin is widely preferred due to its safety profile and effectiveness in reducing blood sugar and controlling weight. Gliclazide is useful for patients who need a boost in insulin production but should be used with caution due to the risk of hypoglycemia. Rosiglitazone, while effective in improving insulin sensitivity, requires careful monitoring due to its potential risks. In clinical practice, the choice of medication depends on the patient's individual profile, including residual insulin production capacity, risk of hypoglycemia, weight concerns, and possible comorbidities. Often, a combination of medications is necessary to optimize glycemic control and minimize side effects. Insulin resistance, the real problem of diabetes. Insulin resistance is a central factor in the development of type 2 diabetes. This condition occurs when the body's cells become less sensitive to insulin, a hormone essential for regulating blood sugar levels. Insulin facilitates the entry of glucose into cells, where it is used as an energy source. When there is insulin resistance, this function is impaired, resulting in elevated blood glucose levels. Insulin resistance usually precedes the diagnosis of type 2 diabetes by many years. The pancreas responds to the resistance by producing more insulin to try to compensate for the decreased cellular sensitivity. Initially, this increase in insulin production can keep blood glucose levels within the normal range, but as resistance worsens, the pancreas can no longer keep up with the demand, leading to chronic increases in glucose levels. Several factors contribute to insulin resistance, including genetics, obesity, sedentary lifestyle, and a diet rich in refined carbohydrates and sugars. Excess body fat, especially visceral fat around the internal organs, is strongly associated with insulin resistance. This occurs because adipose tissue releases inflammatory substances that interfere with insulin action. Insulin resistance not only leads to type 2 diabetes but is also associated with other metabolic conditions such as hypertension, dyslipidemia, and cardiovascular disease. Therefore, it is crucial to address insulin resistance comprehensively, not just to control diabetes but also to reduce the risk of other related complications. Effective treatment of insulin resistance involves lifestyle changes such as adopting a healthy diet, regular physical exercise, and weight loss. Dietary interventions that reduce the intake of refined carbohydrates and increase the intake of fibers and healthy fats can improve insulin sensitivity. Intermittent fasting has also been shown to be effective in reducing insulin levels and improving insulin resistance. In some cases, medications may be necessary to help control blood sugar and improve insulin sensitivity. Diabetes. Treating the symptoms versus treating the cause. Comparing diabetes to an infection offers a useful perspective on the importance of treating the underlying cause of the disease rather than just its symptoms. In the case of a bacterial infection, the visible symptom may be a fever. However, treating the fever with antipyretics, such as paracetamol, does not address the cause of the infection, which are the bacteria. To resolve the infection, it is necessary to use antibiotics that eliminate the causative bacteria. Similarly, in type 2 diabetes, the visible symptom is elevated blood sugar levels. Conventional treatments often focus on reducing these levels with medications that increase insulin production or improve glucose absorption. However, these treatments do not address the underlying cause of diabetes, which is insulin resistance. Insulin resistance is the real infection in type 2 diabetes. Without treating this resistance, the body continues to need more insulin to control blood sugar levels. Eventually, even with medications, the body may not be able to keep up with the growing demand, resulting in disease progression. Therefore, to effectively treat type 2 diabetes, it is essential to focus on the root cause, insulin resistance. This can be done through lifestyle changes such as adopting a low glycemic diet, regular physical exercise, and incorporating practices such as intermittent fasting. These interventions help reduce insulin resistance and restore the body's sensitivity to the hormone. Just as treating a bacterial infection with antibiotics cures the disease, treating insulin resistance can reverse type 2 diabetes. Focusing only on blood sugar levels is equivalent to treating only the fever in an infection, providing temporary relief but not a lasting solution. Addressing the underlying cause is the key to effective and sustainable treatment of type 2 diabetes, preventing long-term complications and improving patients' quality of life. The problem of focusing solely on blood sugar in diabetes treatment. The standard treatment of type 2 diabetes often focuses exclusively on controlling blood sugar levels. While this can provide immediate symptom relief and reduce the risk of acute complications, it does not address the underlying cause of the disease, which is insulin resistance. The use of medications such as metformin, gliclazide, and exogenous insulin helps lower blood glucose levels but often leads to a cycle of growing dependence. As insulin resistance worsens, higher doses or more medications are needed to maintain blood sugar levels. This can result in side effects such as weight gain, hypoglycemia, and cardiovascular complications. Furthermore, focusing solely on blood sugar control does not prevent the progression of diabetes. Studies have shown that even with strict blood glucose control, patients can still develop long-term complications such as heart disease, kidney disease, and neuropathies. This is because insulin resistance continues to worsen, causing ongoing damage to the body. Another problem with standard treatment is that it can give patients a false sense of security. When blood sugar levels are controlled, they may believe the disease is under control, when in fact insulin resistance and elevated insulin levels continue to cause harm. This can delay the adoption of lifestyle changes that are crucial for effective diabetes treatment. Dependence on medications also overlooks the importance of dietary and lifestyle interventions. Type 2 diabetes is largely a dietary disease. Without significant changes in diet and lifestyle habits, it is unlikely that blood sugar control alone will lead to disease remission. Approaches such as low-carbohydrate diets, increased physical activity, and practices like intermittent fasting are essential to reduce insulin resistance and treat the root cause of diabetes. In summary, while blood sugar control is important, it should not be the sole focus in the treatment of type 2 diabetes. A more holistic approach that includes dietary interventions, lifestyle changes, and an understanding of insulin resistance is necessary for effective disease treatment and long-term complication prevention. Why treating insulin resistance is essential for diabetes control. Treating insulin resistance is crucial for combating type 2 diabetes. Insulin resistance is the inability of the body's cells to respond adequately to the hormone insulin, resulting in elevated blood glucose levels. It is the underlying cause of type 2 diabetes and, if not addressed, the disease will continue to progress regardless of blood sugar control. Insulin resistance is often caused by lifestyle factors such as a diet rich in refined carbohydrates and sugars, sedentary behavior, and obesity, especially visceral fat. These factors contribute to a chronic inflammatory state and increase insulin production by the pancreas. Over time, the pancreas cannot produce enough insulin to overcome the resistance, resulting in persistent hyperglycemia. To effectively combat type 2 diabetes, it is essential to focus on reducing insulin resistance. This can be achieved through several strategies. Dietary changes are crucial. Reducing the intake of refined carbohydrates and sugars and increasing the intake of fiber-rich foods, healthy fats, and proteins can improve insulin sensitivity. Low-carbohydrate diets have been shown to be effective in reducing insulin levels and controlling diabetes. Regular physical exercise is another important intervention. Resistance and aerobic exercises increase muscle cell insulin sensitivity, helping lower blood glucose levels. Additionally, physical activity helps with weight loss, which is a crucial factor in reducing insulin resistance. Intermittent fasting is an additional strategy that can be effective. By alternating periods of eating with periods of fasting, insulin levels are reduced, which can help break the cycle of insulin resistance and high insulin levels. Besides these lifestyle changes, it is important to monitor and, when necessary, adjust medications to avoid excess insulin, which can worsen insulin resistance. Medications that improve insulin sensitivity, such as metformin, can be helpful but should be combined with dietary and lifestyle interventions. In summary, treating insulin resistance is essential to control and potentially reverse type 2 diabetes. This requires a multifaceted approach that includes diet, exercise, intermittent fasting, and careful medication management. The vicious cycle of insulin resistance and high insulin levels. The vicious cycle of insulin resistance and high insulin levels is one of the main challenges in treating type 2 diabetes. This cycle begins when the body's cells become resistant to insulin, requiring larger amounts of the hormone to allow glucose to enter the cells. In response, the pancreas increases insulin production, leading to chronically elevated insulin levels in the blood. High insulin levels, in turn, exacerbate insulin resistance. This occurs because excess insulin can overload insulin receptors on cells, making them less sensitive to the hormone. Additionally, high insulin levels promote fat storage, especially visceral fat, which releases inflammatory substances that further contribute to insulin resistance. This vicious cycle can be difficult to break. As insulin resistance increases, the body requires even more insulin to keep glucose levels under control. This can lead to the depletion of pancreatic beta cells, which are responsible for insulin production, resulting in decreased insulin production over time and worsening glycemic control. To break this cycle, it is essential to adopt strategies that reduce both insulin resistance and insulin levels. Dietary changes are fundamental. Low-carbohydrate diets can reduce insulin demand, helping lower blood insulin levels. Additionally, including foods rich in healthy fats and fibers can improve insulin sensitivity. Intermittent fasting is another effective approach. By reducing meal frequency, insulin levels remain low for longer periods, which can help restore cell sensitivity to insulin. Regular physical exercise is also essential, as it increases glucose uptake by muscles independently of insulin, helping lower blood glucose levels and the need for insulin. Besides lifestyle changes, careful medication management is important. Medications that increase insulin production should be used with caution, as they can perpetuate the cycle of insulin resistance. Instead, medications that improve insulin sensitivity, such as metformin, may be more appropriate. Breaking the vicious cycle of insulin resistance and high insulin levels is crucial for the effective treatment of type 2 diabetes. This requires an integrated approach that combines diet, exercise, intermittent fasting, and careful medication management. Intermittent fasting. How it can help control diabetes. Intermittent fasting is an effective strategy to reduce insulin levels and treat type 2 diabetes. This practice involves alternating periods of eating with periods of fasting, allowing the body to naturally reduce insulin levels and improve insulin sensitivity. During fasting periods, the body does not receive new calories, leading to a decrease in insulin levels. This allows the body to use its fat and glucose reserves for energy, helping to reduce blood sugar levels and insulin resistance. Intermittent fasting also helps break the vicious cycle of high insulin levels and insulin resistance, promoting weight loss and metabolic improvement. There are several forms of intermittent fasting, including the 16/8 method, where a person fasts for 16 hours and eats within an 8-hour window, and the 5:2 method, which involves eating normally for 5 days a week and consuming a very reduced amount of calories on the other 2 days. Each method can be adapted to individual needs and preferences, making intermittent fasting a flexible option for many people. Studies have shown that intermittent fasting can be more effective than continuous calorie restriction in improving insulin sensitivity and promoting weight loss. Additionally, intermittent fasting has additional benefits such as improving cardiovascular health, reducing inflammation, and promoting autophagy, a process by which the body cleans out damaged cells and regenerates new ones. Implementing intermittent fasting requires guidance and medical supervision, especially for people with type 2 diabetes who are on medication. Medication doses may need to be adjusted to avoid hypoglycemia during fasting periods. Additionally, it is important to ensure that meals during eating periods are nutritious and balanced, rich in fibers, proteins, and healthy fats, and low in refined carbohydrates and sugars. Intermittent fasting offers a powerful and natural approach to treating type 2 diabetes, directly addressing insulin resistance and promoting metabolic health. Combined with other lifestyle changes such as regular exercise and a healthy diet, intermittent fasting can help many patients achieve better disease control and improve their quality of life. Success stories with intermittent fasting in diabetes control. Several success stories demonstrate the effectiveness of intermittent fasting in treating type 2 diabetes. These examples illustrate how the combination of fasting and dietary changes can lead to reduced blood sugar levels, weight loss, and, in many cases, disease remission. A notable example is Richard, who had diabetes for over 10 years and had kidney complications. After starting an intermittent fasting regimen in 2013, Richard gradually reduced his weight from 113 kilograms to 95 kilograms. His waist size decreased significantly, and his hemoglobin A1C levels, a marker of glycemic control, remained stable below 7%. Most impressively, Richard managed to stop using insulin and other diabetes medications, maintaining his blood sugar levels within the normal range. Another case is Balraj, diagnosed with diabetes in 2003 and who also had complications. After starting intermittent fasting, he managed to reduce his weight from 84 kilograms to 76 kilograms, and his hemoglobin A1C levels dropped from 8.5% to 6.3%. As a result, Balraj did not need to start using diabetes medications, controlling the disease solely with diet and fasting. Desmond is another success story. With a history of heart problems and diabetes, he managed, through intermittent fasting, to reduce his weight, decrease his waist size, and maintain stable blood sugar levels. He went from 25 units of insulin per day to 0, using only oral medications to maintain glycemic control. These cases show that intermittent fasting can be a powerful tool for managing type 2 diabetes. The regular practice of fasting, combined with a healthy diet and proper medical supervision, allows patients to reduce their dependence on medications and insulin, improve insulin sensitivity, and achieve better metabolic health. Each of these patients experienced significant improvements in quality of life and diabetes control, highlighting the potential of intermittent fasting as a viable and effective approach to treating type 2 diabetes. These examples reinforce the need to consider dietary and lifestyle interventions as an integral part of diabetes management. Diabetes. How diet is key to disease control. Type 2 diabetes is widely recognized as a dietary disease, resulting from inadequate eating habits and lifestyle choices. Excessive intake of refined carbohydrates, sugars, and processed foods contributes to the development of insulin resistance, the main underlying mechanism of type 2 diabetes. Therefore, to effectively treat this condition, it is crucial to address diet and promote sustainable dietary changes. A diet high in refined carbohydrates and sugars causes constant spikes in blood glucose levels, leading to chronic increases in insulin levels. This continuous cycle of high insulin levels and insulin resistance contributes to the progression of diabetes. Additionally, processed foods often lack fiber and essential nutrients, further exacerbating the problem. To effectively treat type 2 diabetes, it is necessary to adopt a dietary approach that minimizes the intake of refined carbohydrates and sugars while increasing the consumption of whole, nutrient-rich foods. Low-carbohydrate diets have been particularly effective in reducing insulin levels and improving insulin sensitivity. These diets emphasize the consumption of vegetables, lean proteins, healthy fats, and fibers, which help stabilize blood sugar levels and promote satiety. Besides dietary changes, intermittent fasting can be a powerful tool in treating type 2 diabetes. Fasting helps lower insulin levels, allowing the body to use its fat and glucose reserves for energy. This not only improves insulin sensitivity but also promotes weight loss, which is a crucial factor in managing diabetes. Regular physical exercise is also essential. Activities such as walking, running, cycling, and strength training help increase glucose uptake by muscle cells, independently of insulin, thus improving glycemic control and insulin sensitivity. In summary, treating type 2 diabetes as a dietary disease requires a holistic approach that includes significant dietary changes, intermittent fasting practices, and regular physical activity. These interventions not only help control blood sugar levels but also address the underlying cause of insulin resistance, promoting better metabolic health and a superior quality of life for patients. The problems of conventional insulin treatment. The conventional treatment of type 2 diabetes with insulin has been criticized for several limitations and adverse effects. While insulin is effective in lowering blood glucose levels, it does not address the underlying cause of diabetes, which is insulin resistance. Instead, it can perpetuate a vicious cycle of high insulin levels and insulin resistance. One of the main criticisms of insulin use in type 2 diabetes is that it can lead to weight gain. Insulin promotes glucose storage as fat, and many patients report significant weight gain after starting insulin therapy. This additional weight gain can worsen insulin resistance, creating a cycle of increasing insulin need to control blood sugar levels. Furthermore, insulin use can increase the risk of hypoglycemia, a potentially dangerous condition characterized by abnormally low blood sugar levels. Hypoglycemia episodes can be frightening and harmful, especially if they occur at night or during activities requiring attention, such as driving. Another criticism is that insulin treatment addresses only the symptoms of diabetes, high blood sugar levels, and not the root cause, insulin resistance. Studies have shown that even with strict glucose control, patients can still develop long-term complications such as cardiovascular, kidney, and neuropathic diseases. This suggests that focusing exclusively on blood sugar control may not be enough to prevent diabetes complications. Additionally, exogenous insulin can increase blood insulin levels, exacerbating insulin resistance in the long term. Instead of improving insulin sensitivity, the increase in insulin levels can lead to a greater need for insulin, perpetuating the vicious cycle of the disease. The most effective approach to treating type 2 diabetes should focus on reducing insulin resistance rather than just controlling glucose levels. Dietary interventions, such as low-carbohydrate and intermittent fasting diets, as well as regular physical exercise, can help lower insulin levels and improve insulin sensitivity. These strategies address the underlying cause of type 2 diabetes, offering a more sustainable and effective approach to disease treatment. In summary, while insulin may be necessary in certain cases, conventional insulin treatment for type 2 diabetes has significant limitations. Approaches that aim to reduce insulin resistance and improve overall metabolic health should be prioritized for more effective and lasting disease management. Fasting versus bariatric surgery. Which is better for diabetes? Intermittent fasting and bariatric surgeries are two distinct approaches to treating type 2 diabetes, but both aim to reduce insulin resistance and improve metabolic health. Comparing these two strategies reveals significant differences in terms of invasiveness, risks, costs, and long-term outcomes. Bariatric surgeries, such as gastric bypass and sleeve gastrectomy, are invasive procedures that reduce the stomach size and, in some cases, alter the digestive tract. These procedures result in significant and rapid weight loss, and many patients experience remission of type 2 diabetes shortly after surgery. The drastic reduction in caloric intake and nutrient absorption leads to a rapid decrease in insulin levels and improves insulin sensitivity. However, bariatric surgeries are not without risks. Surgical complications, such as infections, digestive problems, and nutritional deficiencies, can occur. Additionally, these procedures are expensive and require lifelong commitment to nutritional supplementation and medical monitoring. Bariatric surgery also carries a psychological risk, as rapid changes in the body and diet can be difficult to manage. On the other hand, intermittent fasting is a non-invasive approach that can be implemented without significant cost and without the risks associated with surgery. Intermittent fasting involves alternating periods of eating with periods of fasting, helping to lower insulin levels and promote natural weight loss. This practice can be adapted to individual needs and does not require invasive medical interventions. Studies show that intermittent fasting can be as effective as bariatric surgery in improving insulin sensitivity and lowering blood glucose levels. Additionally, intermittent fasting has additional benefits such as promoting autophagy, a cellular renewal process that can improve overall health. The main advantage of intermittent fasting is that it can be maintained long-term as part of a healthy lifestyle. Unlike surgery, which is a one-time and drastic solution, intermittent fasting allows for continuous and personalized adjustments to diet and eating routine. In summary, while bariatric surgeries can offer quick and significant results for treating type 2 diabetes, intermittent fasting offers a non-invasive, flexible, and sustainable alternative. Both approaches have their merits, but intermittent fasting may be preferable for those looking to avoid the risks and costs associated with surgery. Diet and fasting, the powerful duo against diabetes. Diet and fasting play crucial roles in controlling and potentially curing type 2 diabetes. Adopting a healthy diet and incorporating intermittent fasting practices can significantly improve insulin sensitivity, reduce blood glucose levels, and, in many cases, lead to disease remission. An appropriate diet for controlling type 2 diabetes should be rich in whole foods, such as vegetables, fruits, lean proteins, healthy fats, and fibers. Reducing the intake of refined carbohydrates and sugars is essential, as these foods cause spikes in blood glucose levels and increase insulin demand. Low-carbohydrate diets, such as the ketogenic diet, have shown effectiveness in reducing insulin levels and improving glycemic control. Intermittent fasting is an eating practice that alternates periods of eating with periods of fasting. During fasting periods, insulin levels drop, allowing the body to use fat reserves for energy. This not only helps with weight loss but also improves insulin sensitivity. Intermittent fasting can be implemented in various ways, such as the 16/8 method, where a person fasts for 16 hours and eats within an 8-hour window, or the 5:2 method, which involves eating normally for 5 days and restricting calories on the other 2 days. Besides lowering insulin levels, intermittent fasting promotes autophagy, a cellular renewal process that can improve metabolic health and reduce inflammation. This process is particularly beneficial for people with type 2 diabetes, as it helps repair cellular damage and improve the function of pancreatic beta cells responsible for insulin production. Clinical studies and success stories show that the combination of a healthy diet and intermittent fasting can lead to type 2 diabetes remission. Patients who adopt these practices often experience significant reductions in blood glucose levels, weight loss, and, in many cases, are able to reduce or even eliminate the need for diabetes medications. It is important that any changes in diet or intermittent fasting practice be made under medical supervision, especially for people who are already on medication. Medication doses may need to be adjusted to avoid hypoglycemia during fasting periods. In summary, a healthy diet and intermittent fasting are powerful tools in controlling and potentially curing type 2 diabetes. By addressing the underlying cause of the disease, which is insulin resistance, these practices offer an effective and sustainable approach to improving metabolic health and patients' quality of life. How fat, fiber, vinegar, and spices help with diabetes. Protective dietary factors such as healthy fats, fiber, vinegar, and spices play a significant role in managing type 2 diabetes and improving metabolic health. Incorporating these elements into the diet can help lower insulin levels, improve insulin sensitivity, and promote better glycemic control. Healthy fats, found in foods like avocado, olive oil, nuts, and fatty fish, are essential for a balanced diet. Unlike refined carbohydrates, fats do not cause blood glucose spikes and help keep insulin levels stable. Diets rich in healthy fats, such as the Mediterranean diet, have shown benefits in reducing the risk of type 2 diabetes and improving cardiovascular health. Dietary fiber, present in vegetables, fruits, legumes, and whole grains, is another crucial component. Fiber helps slow down glucose absorption, preventing rapid blood sugar spikes after meals. Additionally, fiber promotes satiety, aiding in weight control, which is an important factor in diabetes management. Diets rich in fiber are associated with a lower risk of developing type 2 diabetes and better disease management in people already diagnosed. Vinegar, especially apple cider vinegar, has been studied for its beneficial effects on reducing blood glucose levels and improving insulin sensitivity. The acetic acid in vinegar can help reduce the glycemic response to carbohydrate-rich foods. Incorporating a small amount of vinegar into meals can be a simple and effective strategy to improve glycemic control. Spices such as cinnamon and turmeric also have beneficial properties for metabolic health. Cinnamon has shown potential in lowering blood glucose levels and improving insulin sensitivity. Turmeric, on the other hand, has anti-inflammatory and antioxidant properties that can help reduce inflammation associated with insulin resistance. Adding these spices to the diet can offer additional benefits in managing type 2 diabetes. Besides these protective dietary factors, maintaining a balanced and varied diet rich in nutrients is fundamental for overall health and diabetes management. Combining healthy fats, fibers, vinegar, and spices with other healthy dietary practices such as intermittent fasting and reducing refined carbohydrate intake can provide a comprehensive and effective approach to disease control. In summary, protective dietary factors such as healthy fats, fibers, vinegar, and spices play an important role in managing type 2 diabetes. Incorporating these elements into the diet can help improve insulin sensitivity, reduce blood glucose levels, and promote better metabolic health. How a high insulin diet causes obesity and diabetes. The hormonal obesity theory suggests that hormonal imbalances, particularly high insulin levels, are primarily responsible for the obesity and type 2 diabetes crisis. This theory highlights insulin as a central hormone in fat storage and metabolism regulation. Insulin is produced by the pancreas in response to food intake, especially carbohydrates. It allows glucose to enter cells to be used as energy or stored as fat. However, a diet high in refined carbohydrates and sugars causes frequent insulin spikes, leading to chronically elevated insulin levels. This results in insulin resistance, where cells become less sensitive to insulin, requiring larger amounts to keep blood glucose levels under control. Insulin resistance not only contributes to type 2 diabetes but also to obesity. High insulin levels promote fat storage and prevent the breakdown of stored fat, making weight loss difficult. This vicious cycle of high insulin levels and insulin resistance is exacerbated by diets rich in processed foods and poor in nutrients. The hormonal obesity theory explains why traditional calorie-restricted diets often fail in the long term. Simply reducing calories without addressing insulin levels may not be effective, as high insulin levels continue to promote fat storage and insulin resistance. To combat the obesity and type 2 diabetes crisis, it is essential to focus on reducing insulin levels. This can be achieved through low-carbohydrate diets that minimize the intake of refined carbohydrates and sugars and promote the intake of healthy fats and proteins. Intermittent fasting is also an effective tool, as it helps lower insulin levels by alternating periods of eating with periods of fasting. Additionally, increasing physical activity is important, as exercise improves insulin sensitivity and helps regulate blood glucose levels. Reducing stress and getting adequate sleep are also crucial, as stress and sleep deprivation can increase cortisol levels, another hormone that can raise insulin levels. In summary, the hormonal obesity theory provides a deep understanding of the underlying causes of obesity and type 2 diabetes. Addressing hormonal imbalances, particularly insulin, through dietary changes, intermittent fasting practices, physical exercise, and stress management, is essential to reversing these conditions and improving overall metabolic health. Thank you for watching. Don't forget to subscribe to the channel. I wish you great health, wealth, and happiness. See you in the next video.